how would you regulate a Facebook?
Well, I think you'd do it exactly the same way that you regulated the cigarette industry. Cigarettes, they're addictive, you know, they're not good for you. There's a lot of parallels.
That's Salesforce CEO Marc Benioff in Davos this past week. He's the latest Silicon Valley insider to call on governments to rein in social media. Okay, Facebook doesn't have nicotine in it, but study after study has argued it can make us depressed. One of Facebook's first employees says he feels guilty about the platform he helped build.
What it really is fake brittle popularity. That's short-term, and that leaves you even more, and admit it, vacant and empty. The short-term dopamine-driven feedback loops that we have created are destroying how society works.
There are also huge privacy issues, and bad actors have used Facebook to manipulate elections. CEO Mark Zuckerberg knows there's a problem. He's vowed to, quote, fix Facebook himself. I'm joined by CBC tech commentator and futurist Jesse Hirsch. So, Jesse, he's making the comparison to Facebook is like cigarettes, but it's not killing us.
Well, it rose so fast, I don't think we realized what the health impacts could be. But now that the research is catching up, yeah, cigarettes may be an apt analogy. Not so much that it's killing us, but that the hidden health effects are not only substantive, but could be quite a cost to society, whether it's the mental health around depression, whether it's the time of people being addicted and losing productivity. But then there's the larger issue of narcissism and the culture in which it sort of gives us role models or gives us incentive to perhaps act in antisocial ways that as a society we're now questioning. So it's one of the reasons, whether you think of it as a narcotic, whether you think of it as medicine, that maybe it should be tested more thoroughly, but also be subject to oversight.
How would it work? Like you mentioned, medication.
So one of the big ideas being forwarded by researchers in the field is treating it as if it was a medication, which means a lot of testing before you release it to the population, and you look at side effects, and you clearly communicate to people what those side effects are.
So put those ads out.
Absolutely. And in the case of Facebook, with young people, we're seeing a lot of correlation to lack of sleep and a lot of correlation to mental health issues such as depression. So these are important things to warn users, not so much in the terms of service, but clearly so that we can use it responsibly without suffering those consequences.
Almost out of time, but Europe has regulations. Facebook has to follow those. Do you see Canada doing something like this, like the US isn't?
We can and we should, because we have a very powerful bargaining chip, and it's our personal information. Our personal information is so valuable to Facebook that they will bend to whatever rules we make up, because that's how badly they want to have access to what we do and why.
Jesse Hirsch, thanks so much. Interesting as always.
Thanks, Wendy.